Hey there, my name is Peter. I am a health and safety facilitator, and in this video, I am going to demonstrate how to administer CPR on an adult. Suppose you find someone lying down on the floor. What are you going to do? First thing, assess the scene. Look around and make sure the scene is safe. Are there safety hazards, a chemical spill, electrical wires, gas fumes, or anything dangerous? You can't help anyone if you get hurt too. If the scene is safe, check the person for a response. Tap or shake the victim on the shoulder and shout, "Are you okay?" If you do not get a response from the victim, yell for help and tell someone next to you to call 911 and get an AED. Many facilities will have an AED. Facilities such as stores, schools, airports, shopping malls, stadiums, and more have an AED for emergency situations. Next, you need to check the victim for breathing or only gasping. You need to scan the body back and forth from head to abdomen for at least 5 seconds, but no more than 10 seconds. You must take note that agonal breathing sounds like gurgling or gasping, but it is not breathing. You must start CPR immediately. To start CPR, you need to first check for a pulse. To check for a pulse, place your fingers on the center of the neck and slide your fingers down on the side of the neck. If the victim has a pulse but is not breathing, give one rescue breath every 5 seconds and recheck the pulse every 2 minutes. This is how you perform a rescue breath. First, gentle tilt the victim's forehand backwards with one hand and with the other hand, lift the victim's chin. This will help to open an airway. Pinch the victim's nose and cover their mouth with your mouth, breathing life-giving air to the victim. If you have a one-way mouth guard, use it as directed to protect yourself from vomit, infectious fluids, and anything that might come out of the victim's mouth. Now you need to start with the CPR cycle. To start the CPR cycle, remove clothing from the victim's chest where possible. Next, locate your hand placement for compressions. Using your hand, draw a line from armpit to chest for hand placement. Place the heel of one hand on the lower half of the breastbone and place your other hand over the first hand. With your arms straight and your shoulders positioned over the victim's chest, push down on the chest. For an adult, push at least 5 inches, but not more. Make sure you give at least 100 compressions in a minute. You may lift your hand slightly in between. If all went well, your victim should be fine and just need a brief medical examination by a professional. However, if your victim is not fine after performing 5 cycles of CPR, you need to call 911 or the emergency helpline immediately. Matana Training Consultants, Careers and Employable Skills Training.